Greetings on the World Diabetes Day. India is a diabetic capital, it is said. The population of India is so huge, almost 1.39 billion people. Out of these 1.39 billion people, the current diagnosed in 2017, the people who were diagnosed to have diabetes was 72.9 million people. In 2019, 77 million people were diagnosed to have diabetes. And it is estimated that in 2030, 100 million people, and in 2045, 134 million people will be diagnosed to have diabetes. But let me tell you that out of the total diabetic population, only 50% are diagnosed to have diabetes. Rest 50% do not get diagnosed, they do not approach the doctors, they do not know, they are not aware of any symptoms, or they do not care for themselves and don't get diagnosed as diabetics. Out of the 50% who are diagnosed to have diabetes, only 50% will get standard care of treatment. So that comes to only 25% will get proper treatment. Out of these 25%, only 50% will have their blood sugars controlled. And of those who have their blood sugars controlled, only 50% will have their other parameters in control, like blood pressure, cholesterol, kidney function, liver function, etc. So it is really a very, very important situation that we increase the awareness, we dispel the myths regarding diabetes, so that more and more people can be diagnosed, more and more people get treatment, and they can be controlled properly. Today I shall take a small step in dispelling few myths related to diabetes. The first and the foremost myth is eating sugar or sweets will lead to diabetes. No, that is not at all true. Whatever we eat gets converted into glucose in our body. So even if we eat chapati, rice, vegetables, fruits, sweets, we drink cola or take biscuits, bread or eggs, non-veg items, oil, butter, everything will get converted into glucose because cell utilizes glucose as the primary fuel. For this cell to use this glucose as a fuel, it requires insulin. So if the action of the insulin is impaired, as in type 2 diabetes, or if it is secreted in low quantities, or it is not secreted properly, it is as in type 1 diabetes, that will lead to diabetes mellitus. So if your metabolism of this insulin is normal, whatever amount of sugar or sweets you eat, that will get converted into energy. The extra glucose will get converted into glycogen for further use. So if you have this normal metabolism, eating sugar or sweets will not make you diabetic, but of course it will predispose you to become obese, which is a main risk factor for diabetes development. So moderation in eating is a key to staying healthy. Why unnecessarily overburden your metabolism with extra sugar? That is, by eating sugar is not bad, and it will not lead to diabetes, but it will definitely predispose you to obesity, which is a risk factor for diabetes. Another myth is, if no one in my family has diabetes, how can I get it? Many times the patients who are recently diagnosed with diabetes will ask us these questions. Type 1 diabetes has genetic linkages, type 2 diabetes has familial hereditary linkages. So if you have someone in the family with diabetes, especially so in the immediate family, then your chances of getting diabetes are really very high. But type 2 diabetes, that is the adult onset diabetes, and this is mostly due to poor lifestyle choices. So even if none of your family members have diabetes, but you have poor lifestyle and the risk factors which are predisposing to diabetes, then you can get diabetes. So what are these risk factors which predispose one to diabetes? Obesity, or the abdominal obesity, that is most important and the primary cause of obesity. A pre-diabetic condition, a gestational diabetic, that is if a person had diabetes in pregnancy. PCOS, age more than 45 years, inactive or sedentary lifestyle, stress, and certain medications. They are the predisposing factors for diabetes. So, maintaining a good lifestyle, having good lifestyle choices will help you in staying away from diabetes. Another third myth that I would like to say is all overweight people will develop diabetes and thin people will not develop diabetes. This is not true, because the obese people have high risk of developing diabetes, but all obese people will not develop diabetes because of their efficient insulin metabolism. Some thin people may have diabetes because either they have type 1 diabetes or some secondary forms of diabetes. But usually the adult type of diabetes, that is if you have other poor lifestyle choices as I mentioned, other than the obesity, and if you have high visceral fat, that is the fat which is deposited inside your organs like liver, spleen, pancreas, or in the kidneys, this fat will lead to your pancreatotoxicity, leading to insulin resistance and leads to diabetes. So, it is not always necessary that a thin person will not develop diabetes, and it is not necessary that an obese person will always develop diabetes. But it is always advisable that an obese person should try to reduce the weight and remain active, so you can stay healthier for few more years. Fourth myth is that diabetes can be cured by natural remedies. It is really a very pathetic situation. There are so many people nowadays who are promoting that they can cure diabetes. Let me tell you, diabetes has no cure like malaria or tuberculosis. Yes, temporary reversal of diabetes is possible. Postponement of diabetes development is possible in high-risk groups. Postponement of diabetes complications is possible in the already diabetic patients, but cure of diabetes is not possible. The mainstay here is making good lifestyle choices, reduce your carbohydrate or total calorie intake, regular exercises, reduce the stress levels, maintain a normal weight. If you are overweight, reduce your weight. So these measures will help you in postponement of diabetes, or if you have early diabetes, they will help you in reversal of diabetes for a short period. But let me tell you, these measures have to be carried lifelong. Diet, usually restrictions, people cannot follow lifelong. For reducing weight, they will do a lot of dietary restrictions, that is okay. But if you have to follow these diet restrictions for lifelong, it is very difficult. And only a few people who are very motivated can do it. But if diabetes is due to some medications, then it can be reversed with stopping of the medicines. Not only allopathic medicines like steroids will lead to diabetes, but certain herbal Ayurvedic medicines also contain some steroid-like substances which might lead to diabetes. Natural products will usually show good control for some time, but then they also have to be taken for lifelong. And the disadvantage of these products is that their purity is disputable, exact dosage is not standardized. So, the natural products do not cure diabetes. Cure for diabetes is not there at present. The next myth is once on insulin means permanently on insulin. That is also not true. Insulin is required permanently only in few cases. Many times we use short-term insulin and sometimes only we use long-term insulin. Let us see, where do we use short-term insulin? A recently detected diabetic patient, if has very high blood sugars, then it's better to start him on insulin to bring his sugars down rapidly. This is important because otherwise this glucotoxicity will cause toxicity to the pancreatic cells and further damage to the pancreas will occur and insulin will be secreted in lesser amounts. So to avoid this glucotoxicity in the initial phases, to rapidly bring down the hyperglycemia, we advise person to start on insulin therapy. Later on, as the sugars are controlled, this insulin can be tapered, reduced and may be stopped as depending upon the patient's condition. Now if the patient is critically ill, his meal timings are not proper, his absorption of the oral medications is not proper, it is not advisable to give him oral medications, because insulin, it can be adjusted very nicely. It can be given for short period of time. Its action starts early, its action ends early, and so its complication and the exact dosages according to the sugar levels can be monitored. If a person has liver or renal dysfunction, in that case also we tend to avoid giving oral drugs till the liver or kidney dysfunction is corrected. If the patient has comatose, where there is no oral intake of food, where the person is getting anything through the enteral routes or through the parenteral route, then that patient requires to be put on insulin. Or if the person is mentally unstable or due to some certain medical conditions and is not able to take food in a proper exact timings and erratic intake of food will be there, in such cases also it's better to avoid oral medications and put the patient on insulin. If the patient has intestinal malabsorption due to certain conditions and before surgical procedures, it is advisable that we put the patient on insulin, because they will stay fasting for a long time during the surgery, before surgery, because the anesthesia has to be given, and the oral medications, if they are present, they will keep on acting when you don't have any intake. So these are few conditions where it is better to start insulin. But long-term insulin is required in type 1 diabetics because they are insulin dependent. In chronic kidney diseases, in chronic liver diseases, you require insulin. Long-standing diabetes, usually insulin reserves also start depleting. So in these patients, if there is no insulin, the medicines cannot act. The medicines act to enhance the effect of insulin, or some medicines secrete insulin. But if the patient's insulin reserves are nil, the medicines cannot act properly. So these people have to be put on insulin. Or if there is failure of the oral hypoglycemic agents, or if there are some side effects of oral hypoglycemic agents, you have to put the patients on insulin. So also this dispels the myth that those who are on insulin have severe diabetes and they are in their last stages of diabetes. No, that is not true. This helps you to have a better control of your sugars. Now, with diabetes comes maximum question about your eating habits. Let us take few of them. Diabetes and fruit intake. There are two types of myths prevalent. They are extreme views. Some say diabetics should not take any type of fruits, and some people say diabetic can eat any kinds of fruits because it contains fructose and not sucrose like in sugar. So they can be consumed very safely. Both the statements are not correct. Fruits are good sources of antioxidants, vitamins and minerals. So generalizing them as very good or very bad is not true. There are certain fruits which on metabolization produce high levels of glucose, where some fruits produce lower levels of glucose. See, whatever fructose we consume, 29 to 54% of this fructose gets converted into glucose. Approximately 25% gets converted into lactate and 15 to 18% gets converted into glycogen. Less than 1% directly gets converted into triglycerides. So portion control is very important. The fruits which have a low glycemic index and a low glucose load can be taken regularly in moderate amounts, whereas fruits with high GI index and high glucose load should be taken only in limited amounts and occasionally. Again, moderation is the key to staying healthy. Fruits which can be consumed regularly are citrus fruits, apple, papaya, pear, melons, berries. But calorie-dense fruits like bananas, mangoes, guava, chiku, grapes, custard apple should be avoided. Another myth is that eating jaggery or honey is okay instead of eating refined sugar. Let us see what is the difference between this glucose, white sugar and jaggery, honey. I will just tell you some comparison between these glucose, white sugar, brown sugar, jaggery and honey. The GI index of glucose is 100. That is, glucose gets the conversion of glucose is 100%. Its glycemic load is 50. The calories that it provides is 50. White sugar has a GI of 65, a glucose load of 8 only. That is, suppose if you take equivalent portions, if you take 1 teaspoon of glucose, it will give you 50 calories. 1 teaspoon of white sugar will give you 16 calories. Brown sugar, its GI index is 64, its glycemic load is 68, and the calories that it provides is 12. Jaggery, its GI index is 84.4%, greater than white sugar. The calories that the same amount of white sugar and jaggery will provide, sugar will give you 16 calories, jaggery will give you 36 calories. So jaggery is definite no instead of white sugar if you are thinking of replacing it. Let us look at honey. Honey depends upon which type of honey you are using, from which sources the honey is being produced. Its GI index may vary from 45 to 60. Its glucose load is low, 9, and the equivalent calories are 20. The only advantages with honey is that it provides some vitamins and antioxidants. Next is diabetics should avoid certain sports and strength training exercises. Working out is very, very essential for diabetics. Aerobics exercises in form of brisk walking, jogging, cycling, swimming are recommended as per the patient's health for around 150 minutes per week to maintain good health. Strength training workout should be included for at least 2 sessions, that is twice a week. This helps build muscles and brings down your body fat. So healthy weight loss is accomplished. But if one has to lose weight, one has to put in more efforts and not limit oneself to 150 minutes of aerobic exercises. You have to increase your aerobic exercises, you have to increase your strength training and control your diet. All sports and exercises forms can be followed if you do not have other complications like retinopathy, peripheral or autonomic neuropathy, because these conditions may cause untoward accidents. So it is better to avoid if you have these complications. Only certain precautions need to be taken before following any exercise regimen. Let us look what precautions we have to take. First of all, listen to your body. If your body says, I am good, you are good. If your body says, no, something is wrong, then just listen to your body. Regularity in exercises is also key to maintaining health. Never exercise on empty stomach if your blood sugar value is less than 100 milligrams before you start exercise. In such cases, always eat a small low-calorie snack with approximately 15 to 30 gram of carbohydrate, like some fruits or crackers. Don't miss warm-up and cool down while exercising. Gradually increase your exercise regimen. Don't work out if you are feeling uncomfortable, dizzy, out of breath. Stop whenever you have these symptoms. Get your blood sugar checked immediately. Get your blood pressure checked immediately. And if you still don't feel alright, when you stop the exercise immediately, you have to consult your doctor. Do not indulge in strenuous exercise if your blood sugar is less than 100 or more than 250. Wear proper footwear while exercising. So these are few of the myths that I wanted to dispel. There are so many other myths and the talk will be endless. So hence I just stop over here and wish you a healthy life ahead. Thank you.